Hi, my name's Anndior and I'm a nursing student and I'm currently studying at the University of Brighton and I'm about to go into my third year. The Black Interns programme was an initiative spearheaded by Health Data Research UK, and they did this because they realised that not a lot of Black people had experience and exposure to data science, and that in their companies and their partners that they work with, that there wasn't a high percentage of them being represented. And this also followed into not a lot of data being represented amongst different ethnicities as well. So it was really important for them to make sure that they had people who could represent the data in a way that they understood it as well and be able to be translatable to the communities that they got it from. So I decided to apply for this program because I really wanted to give myself a scope of opportunities. I'm currently a nursing student, and so we don't really get much exposure in terms of data, but we know that data is used to make decisions in the hospital. So it was really important for me to have an understanding and to also just get an experience myself as what it would be like to be in one of these roles. Nursing is a very linear kind of trajectory in terms of going from nursing to the ward. But I guess a lot of people don't know that there's so much more out there that you can do with nursing. And so I've met a lot of nurses and midwives, who have basically been in this data science community. And it's really important that people get to see that we do have a voice in making decisions with data science. Whilst I was at DataCan, I was in the commercial team, and during that time I would go to meetings and I was understanding how data was curated and was being put into data banks so that we could be using it fairly amongst the NHS and other health organisations. Specifically to me, my project was understanding the links, I guess, between health inequalities, social determinants of health, and epigenetics. So I had a main focus on lung cancer because we know that in the UK, 79% of it is preventable. But obviously, we need to understand that our environment is affecting how people are getting cancer. And so I just decided to understand it on a biological level, understanding that is there a biological cause from the environments that we're living in that's causing cancer, and if there's a way that we can stop it through data and bring it to the government so they can understand that there needs to be things put in place to actually stop it. So whilst I was at DataCan, I learned that data is being used in so many ways. It took me a bit of a while to understand that DataCan doesn't actually hold data, but we're really working to make sure that data is used well and in the appropriate way that actually serves people. So in a lot of the meetings I was in, there would always be a patient advocate in there talking about what they think is best for the patient, and they always had a say in making sure where the data goes, how it's used. And because I was in the commercial aspect, of course, we were trying to make sure that if there was any sort of liability, that was understood and that was accepted between the whole team and all the hubs that were involved in making reuse in the data. So I guess my highlights of being at DataCan was because of COVID, we weren't really allowed to be in the office as much, but DataCan was able to facilitate a few days here and there where I could go into the office and see what it was like working with other people. And I guess meeting those people face to face and having that interaction was really good for me. I think another thing was the exposure that I got from it, because I had so many meetings with so many, academics, people who were working in data science, understanding their roles, and, people who really, really wanted to bring diversity to data, because obviously I'm on this initiative program to bring diversity to data, but to know that people actually who are working there want to diversify data itself was really a highlight to me. And I was even asked to do a blog by Genomics England London. And I'll be hopefully writing a blog about diversity in data and what my project was about, because, until we start diversifying data, especially ones that affect only certain groups, then we won't really understand the whole picture of the data we have. But I'm really glad to know that a lot of people are actually working towards this and that they care enough to make space for new ideas and people. So I would definitely recommend the intern to other people. I mean, even if I know this initiative is mainly for Black people, but even people of the BAME community that don't, have this access, I would really talk to universities and different organizations to really open and broaden up the space, because when a space is made for people, they really do really cool things. My project was initially only meant to be a few pages, but it's become way bigger than I thought it would be because of the exposure I've had to talk about my ideas, to really get an insight and understanding into something I wouldn't have. As I said, I'm a nursing student, and nurses don't get that. They have a lot of clinical experience, but they don't get that scientific understanding, which sometimes I feel can be lacking in their skill set. And so being able to broaden my skill set like this has been really good. I feel like no matter what background you come from academically, data is something that everybody should be interested in, because we're using it to make real decisions. And with COVID and everything, data has been something really that's been utilized. And I guess everybody should have an understanding if it plays a big role in the way that, decisions in our lives and communities are informed. So my advice for future interns in this program is not to be scared about what knowledge you don't have. People are so willing to teach and help you learn and help you grow. From my experience, there's nothing that I have not known that hasn't been answered. And I've really been supported across the journey. I think I had fears because I don't come from such a sciencey data background, that I wouldn't be able to actually contribute or do something worthwhile with the time I was given. And so people really invested their time with me. So in the future, I hope to have graduated next year with my degree. And because of how much research I've been doing by myself, I hope to do a master's in cancer research. So I'm really hoping that I can, pursue that once I'm done. And this is really giving me the confidence to do that. And hopefully I'll be back at one of these hubs. I guess one thing I'd like to add is thank you so much to Health Data Research UK and DataCam for putting this initiative together. I think they probably don't know how many people they've impacted, because from my cohort, I've seen a lot of people talking about their experience, how they've been offered jobs. And it's one thing to talk about, wanting to make a change, but they actually have, and that's really amazing. So I just want to thank everybody and every single hub that's really contributed to this.